We are talking about the bird flu today. Number one, I'm going to give you symptoms, and number two, I'm going to tell you how to prevent it. All of this information is according to the CDC. First of all, symptoms. Mild signs and symptoms of bird flu infection include things like eye redness or irritation. We often call this conjunctivitis, but also things like a mild fever or just feeling feverish, cough, sore throat, runny nose, muscle or body aches, headaches, fatigue. Notice it kind of sounds like flu. This is the bird flu. And just know that the eye redness has been sort of a predominant symptom that we've seen in recent US cases of bird flu, okay? Less commonly, things, GI symptoms, diarrhea, nausea, and vomiting, that's less common, and fever may or may not always be present. Keep that in mind. But those are mild symptoms. Symptoms can be escalated, can get worse. So we're talking about a higher or high fever. All the stuff I just mentioned above, like runny nose, all that kind of stuff. But add in the potential for shortness of breath or trouble breathing, even altered consciousness, seizures, and other complications. And the thing about the bird flu is it can lead to complications. What do I mean by that? I mean worse and sort of bigger problems, pneumonia, respiratory distress, kidney failure, multi-organ failure, even septic shock in some. So it's really important to keep in mind that bird flu, again, many of the symptoms are mild, but doesn't have to be. We always certainly worry about people who are either immunocompromised, older folks, younger folks, people with underlying medical conditions, et cetera, et cetera. Bird flu can be quite dangerous. Now, let's go to how to protect yourself, okay? So this is 4 suggestions according to the CDC. All right, number 1. As a general precaution, and again, this is according to the CDC, whenever possible, you should avoid direct contact with sick or dead wild birds, poultry, and other animals, and observe them only from a distance. Number 2, if you must have direct close contact with a sick or dead wild bird, poultry, or other animals, you gotta wear your personal protective equipment. Super important because wild birds can be infected with bird flu even if they don't look sick. Number 3, do not touch surfaces or materials like things like bedding or animal litter or things like that contaminated with saliva or mucus or animal feces from wild or domestic birds or other animals with confirmed or suspected avian bird flu, okay? And number 4, do not touch or consume raw milk or raw milk products, especially, obviously, from animals with confirmed or suspected bird flu. I have a video on raw milk. I do not advise the consumption of raw milk for so many reasons, including concerns about bird flu and other things. I will make sure I link that here. This, again, some of this I was reading verbatim from the CDC because they say it in a way that I think is clear and easy to understand, and I want you to know what the facts are. Understand your risk level. The general population risk is different. It's lower at this point in time than the risk of those people who come in contact with certain animals, livestock, etc. Okay? Keep checking out the CDC for more information. I certainly will keep you updated as well. Guys, I'm Dr. Jen. Please subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, etc. Share this video. Please sign up for my free weekly health newsletter at drjencaudle.com.